Hey, welcome back to the second module in how to support your client through an induction. This module is going to be a lot of info. I will try to not be too wordy. Hopefully, I will explain everything as simple as I can. But we're going to go through the different cervical ripening agents, like the medications that they use for cervical ripening. So there's 4 kind of common options, and those would be Cytotec, which is also called miso or misoprostol. There's Cervidil. There is a Cook or Foley catheter balloon. And then there's laminaria or Dilapan. That is not as common, especially in hospital settings. So, cervical ripening agents. This is the process by which the cervix softens and opens before labor begins. Cervical ripening occurs through a series of biochemical processes that realign collagen molecules, causing the cervix to thin, soften, relax, and dilate in response to uterine contractions. So, a really important step that we don't want to skip over and we don't want to rush it. Okay, most common is Cytotec, miso. If you Google this, there will be tons of very scary information. A lot of that is outdated. I would not encourage your client to Google this drug because it will probably freak them out and they won't want to use it. Now, I'm not trying to spin this in a better light than I should. Really, the way that they used to use Cytotec in the 70s, 80s was pretty dangerous, and they had a lot of bad outcomes because they didn't know as much as we know now. And so now, in this day and age, Cytotec is used very differently. They use very small doses, and they do continuous monitoring with it, so they know if your uterus is getting overstimulated and then they stop, or they have better healthy parameters in place. For instance, they're not going to use it for a VBAC client because Cytotec helps thin the cervix. It also can thin that uterine scar, which is going to result in more uterine ruptures. So, not a good idea for a VBAC person. Okay, so over the years and decades, we have learned how to use Cytotec appropriately, and I think Cytotec is really good at what it does and a really good option for an induction. Now, it is little tablets that most of the time you would take orally. Sometimes they will do it vaginally and just insert it up near the cervix. The usual dose is 50 micrograms orally or 25 micrograms vaginally. The dosage is repeated every 4 hours. So they are going to watch your contraction pattern. Usually they're little tiny baby contractions, so it might look like a lot on the monitor, but a lot of times moms don't feel them. They don't feel super strong. They're not like labor contractions. It's just kind of more uterine irritability contractions, but they can be little and frequent. So if you're having them too frequently, they will maybe switch to a different cervical ripening agent or stop altogether and make a new plan. Okay, this is used off-label for induction. Cytotec is not created for ripening a cervix, but it does a really good job at it. What I see with Cytotec is that every dose over time kind of builds on each other, and so you're not going to see a big difference in your cervical exam. So say you get checked in, you get a dose of Cytotec, and then you get another dose in 4 hours, and you get another dose in 4 hours, and you get another dose in 4 hours. So you've had like 4 doses and it's been 12 hours or whatever. And then you get another cervical check. If your cervical check is basically about the same or maybe just slightly changed a little bit, that is often going to make a parent feel pretty like bummed out and like feeling like this isn't working. That is not the case. I expect that to happen. I expect even 24 hours of cytotech that your cervical exam isn't going to change a lot. And that is not discouraging. I would prep your client for that, but it is still working. And even though we haven't seen a big change in a check, I feel like, and this is just my anecdotal experience of 900 births and dozens of inductions, I think that a cervix that has been through many doses of cytotech is going to respond better to Pitocin than a cervix that hasn't gotten very many doses of cytotech, even if the exam is the same. I feel like it kind of invisibly works and it just responds better when you've had more cytotech than if you haven't. So this is kind of my number one drug of choice for an induction. If you want my opinion, I will give you my opinion because these are my modules, but you don't have to take it. If I were to sign up for an induction, I would say give me as much cytotech as you possibly can over, like what's safe for as long as we can do it, because it works really good. And then your body can respond to the other things and you're just a lot more likely to end in a vaginal birth, in my opinion. Okay. There's that. Then there's Cervidil, and this is similar to cytotech, like in what it's doing and the purpose of it, but it's a very different method. So instead of a pill that you would take orally or vaginally, this is kind of like a tampon insert that they would insert and go right up near your cervix, and it releases prostaglandins, which helps kind of soften and thin your cervix. And the thing about Cervidil that's kind of a bummer is you do have to stay laying down for about an hour or two. And another big side effect of it is that it can cause quite a lot of irritation to the vaginal tissue, which for some people is kind of like, like really uncomfortable. So, you do still have to do continuous monitoring, usually for all of these things, because it's an induction and they just want to make sure like baby's tolerating everything and you're not contracting too much. Cervidil is less frequently offered than cytotech, and the reason is because it's really expensive. And so some hospitals don't even carry it because it's really expensive, whereas cytotech is very cheap. So we're looking at like pennies per pill for cytotech versus like $300 per Cervidil. So a lot of difference financially. In my area, we do not use Cervidil for a VBAC. However, I did recently hear from a nurse who used to work in California say that at their hospital, they would still use Cervidil for a VBAC. So I am curious if you are from another state, what you see where you're from. But as far as I know, it is contraindicated for VBAC use, but maybe not everywhere. So that is something you can inquire about and let me know too, because I'm curious. Then there's laminaria sticks or Dilapan. This is thin, sterilized, dried sticks of seaweed. That's kind of like a tampon, as you can see, and it's inserted through the cervix. So you have to be like a little bit dilated for them to kind of like fit this through. And then what it does is it slowly absorbs fluid and moisture from the surrounding tissue, and it starts expanding, and it goes up to 10 times its original size. It stays in place for about 12 to 24 hours. Also, kind of like the Cervical, it's going to release prostaglandins and help your cervix kind of thin and soften and dilate. Can be a little uncomfortable, cause some cramping, contractions, spotting, that kind of thing. It is possible to have this placed out of the hospital and like go home. So maybe at like a clinic setting or a midwifery birth center setting, and then go home and then come back for removal. I do not see this offered very often, especially for hospital births. Sometimes out of hospital midwives will do this, or maybe even like a family practice doctor who also delivers babies. Sometimes they might be open to this option. So just another thing that you could consider. I would think this would be a really good idea for a VBAC person who needs to be induced, because this is a very natural way of kind of getting things going without introducing like a medical drug to your system. So that's my take on that. And now we're going to get into the catheters. There's a Cook's catheter and a Foley catheter. The Cook's catheter is this double balloon situation. So as you can see, this catheter goes through the cervix. So you do have to be like at least a centimeter-ish dilated. And then a balloon is filled with saline on the inside of the cervix and the outside of the cervix, so that it's putting pressure on both ends of the cervix to help really like manually thin and soften and dilate it. Okay. Now, a Cook's catheter is made for inductions. It is made to help dilate the cervix, whereas a Foley catheter is not. They are using that like off-label for labor. A Foley catheter is really like to drain urine from your bladder. Now, they can sometimes get away with having a Foley and Pitocin. Since the Cook's catheter is made for labor use, they have said like you cannot use that with Pitocin. Whereas since Foley is being used off-label, they can use it with Pitocin because there's no like rules and regulations around it. Also, a Cook's catheter is contraindicated for a VBAC, at least where I'm from, but a Foley is not because they're using it off-label. So you could use a Foley as a VBAC. Okay, I know this is like a lot of information. I could probably do a whole module just on catheters, but I'm trying not to. So these catheters can be left in place for about up to 12 hours. And once your cervix gets to about 4 centimeters, that's about as big as the catheter balloon can inflate. And so once your cervix gets to that point, the balloon's going to fall out. And then we know you're probably around 4-ish centimeters when it falls out on its own. If it's been in for 12 hours and it hasn't fallen out, they're going to deflate it and take it out. Okay. When you have this catheter in, you can still like move around. You can, it's like taped to your leg, and so you can still be a little bit mobile, even though it's kind of uncomfortable and you have like some more attachments to your body. Usually, you're going to feel a lot of pressure, a lot of cramping, and it's pretty painful and uncomfortable. I personally do not love balloons because I would say for about 80% of people, the balloon it skyrockets their pain. So you're going from being not in labor at all, you're not having contractions, you're not in labor. They put this catheter in, and it's so uncomfortable and so painful that you just have swoosh shot up into like, whoa, this is really uncomfortable. I can't tolerate this. And then what happens is people end up getting narcotics, or they end up getting an epidural even at like 1 or 2 centimeters because they can't handle the pain of the catheter. When once that catheter's out, they're fine and they're coping and they're doing okay, because it wasn't labor that was causing the pain, it was the catheter. And so I see, yeah, now that is not true for everyone. There are some people who tolerate it really well. However, I'm going to say probably about 80%, which is a lot, say that this catheter is the worst part of their whole labor and like almost the most painful. So with that said, I would use it very cautiously. Obviously, if you cannot use Cervidil or Cytotec at all, maybe you're VBAC, or maybe your uterus is overreacting and you can't take that for some reason. If this is your only option, then by all means, try it. But I would recommend that if you cannot tolerate it and if it is really uncomfortable for you, that let yourself get some narcotics. Like, that is okay. It is not ideal to get an epidural at 1 or 2 centimeters just because of the balloon. You could, but I wouldn't recommend that. But if you need some pain medicine to help you cope through this, that is not a failure. That is okay. So just give yourself permission to do that. A lot of times providers, they're like, let's go, let's get this induction started. And they might say like, they're going to kind of do a lot of things at once, like get checked in. Maybe let's just do a couple doses of Cytotec because that's good enough. And then they're like, and then we'll start the Foley balloon and Pitocin. Or they'll say, let's do the Cook's catheter. And then once that falls out, we'll do Pitocin and break your water at the same time. Like, they're kind of just like throwing a lot at you all at once. I would caution against that. Unless there's a reason we need to do that, because it is hard to put a body into labor, and the slower we go, especially for these early stages, the more likely it is that your body's going to respond favorably and it's going to work. So kind of the motto is like slow and steady wins the race. Okay. Foley catheter, similar to the Cook's, except it's just 1 saline balloon instead of 2. Again, it's left for about 12 to 24 hours. You're going to feel cramping, pressure, pretty uncomfortable. Once this balloon comes out, like if it falls out on its own, same thing, you're about 4 centimeters. Now the problem with these balloons, again, there's another problem, and here I will switch to this next slide, is that there's something called like the Foley 4, because it is manually making your cervix open to 4 centimeters. So your cervix, like if this works, it falls out. Parents are like, yay, I'm 4 centimeters, like things are working, this is great, I'm so excited, whatever, progress. That's true, but also it's not the contractions that got you to 4. It was manually dilated to 4 by the balloon. And so people are going to almost always have a huge stall in dilation at this point, because we now have to get contractions started that are like working up to that 4 centimeters and then beyond to start making cervical change. So it kind of takes a while for your uterine contractions to like catch up to make progress past that 4 centimeters, if that makes sense. it's a little confusing to explain. So hopefully you're getting what I'm saying. So don't be discouraged. I always tell patients, don't be discouraged if you're on Pitocin and you're having strong regular contractions for many hours after this balloon and your exam is the same and you feel like nothing's happening, nothing's changing, like why isn't this working? It doesn't mean that it's not. It just means your cervix hasn't caught up yet to those strong enough contractions that it needs to move past the 4 centimeter mark. So in conclusion, I don't love balloons. I think they cause more harm than good. And my recommendation to my clients is take as much cervical ripening as you can and then go straight to Pitocin. And let's just try to skip a balloon altogether. Usually what I see is parents handle that much better than when we add a balloon in. So there's my 2 cents. I did notice, and I thought this was interesting, there was a Cochrane review that showed women undergoing an induction of labor that the Foley catheter is less effective than oral meso and was associated with fewer vaginal births. So that backs up my feelings exactly. So, okay. All right, we're going to end this module now. And then when we come back to module 3, we're going to talk through how to help your client navigate the cervical ripening stage. What can you tell them to like encourage them through it and what to pack and expectations. So, okay.